Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another knowledge booster dose, that is a knowledge booster dose part 24. In this we are going to see one-liner questions, their answers with added explanation. This video is going to be very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 23 parts of knowledge booster dose. If anybody has not seen previous knowledge booster dose, please go in the channel's playlist and watch all the previous knowledge booster dose, because those videos are really important for your GPAT Niper DI Pharmacist exam. First question for today's video is nothing but the question number 141, drug of choice for PDA. Basically they are asking what is the drug of choice for PDA. But before that you should know what is meant by PDA. So PDA क्या होता है? It is known as a patent ductus arteriosus. Patent ductus arteriosus. So what is that patent ductus arteriosus? It is a congenital condition. It is a genetic disorder of your heart, genetic defect in the heart. So what happens in this PDA, patent ductus arteriosus? So there is a small hole between pulmonary artery and aorta to prevent the flow of blood into the lungs when a child is in a womb of mother. जब बच्चा माँ की पेट में होता है तो उसकी पल्मोनरी आर्टरी और aorta में एक छेद होता है और जहाँ से ब्लड फ्लो वहाँ पे होता है, ठीक है, लंग्स में नहीं जाता, क्योंकि जब बच्चा माँ के पेट में होता है तो वो सांस नहीं ले पाता. ड्यूरिंग द पीडीए पेटेंट ductus arteriosus. So this ductus arteriosus is present in the all babies. Whenever baby is in a womb of mother, at that time ductus arteriosus is there with every baby. Okay. Soon after the birth of that baby, within a 15 hours, ductus arteriosus should be closed. So ductus arteriosus is open when the baby is in a womb to prevent the blood flow to the lungs, because in the womb baby will not get breathing. So soon after the birth of that baby, so ductus arteriosus should be closed within a 15 hours, then baby will start breathing. Okay. So if there is no closure of this ductus arteriosus in the newborns, अगर ये ductus arteriosus बच्चे जन्म में आने के बाद में अगर close नहीं होता, that is known as a patent ductus arteriosus. There are two treatment strategies for this PDA. First, it can be treated by using the drugs. Okay, and second strategy is there. So if it is not getting treated by drugs, then you have to correct it by surgical intervention. You have to correct that by surgical procedure. So surgical ligation is the second strategy for PDA, patent ductus arteriosus. So दो ऑप्शन होता है यहाँ पे, एक तो आप ट्रीटमेंट दे सकते हो by using different type of drugs. It helps to close the ductus arteriosus. Second ऑप्शन होता है आपके पास में, आप सर्जिकली इनरवेट करके उसको लाइगेट कर सकते हो, उसको क्लोज कर सकते हो. Remember, drug of choice in the patent ductus arteriosus is nothing but the indomethacin. So what is indomethacin? It is a non-steroidal anti-inflammatory drug. Indomethacin having indole group. Okay. Along with this indomethacin, aspirin can be used. Acetyl salicylic acid and indomethacin, both drug can be used for the treatment of patent ductus arteriosus. Indomethacin and aspirin both are nothing but the NSAIDs, non-steroidal anti-inflammatory drug, but also they have anti-platelet effect. So what is the major adverse effect of this indomethacin? So indomethacin causes the frontal headache. इंडोमिथेसिन का एडवर्स इफेक्ट होता है फ्रंटल हेडेक इन एडिशन टू अदर कॉमन इफेक्ट. बाकी जो कॉमन एडवर्स इफेक्ट होता है जैसे नोशिया, वोमिटिंग, डायरिया, गैस्ट्रिक इरिटेशन, बियॉन्ड दैट इट हैज अ वन स्पेसिफिक एडवर्स इफेक्ट known as a frontal headache. Frontal headache is caused by indomethacin. Now aspirin has a Ray's syndrome as a adverse effect. So you just remember drugs used in the treatment of This patent ductus arteriosus is a indomethacin or aspirin, right? Second question for today's session, prostate carcinoma is treated with. देखो पूछा है prostate cancer कौन से ड्रग से ट्रीट किया जाए. So obviously if there is a cancer of prostate gland, so there is a increase in the androgen level. You have to block that androgen. So this flutamide is the drug used in the treatment of cancer. So it blocks the androgen. It blocks the androgen receptor, or it blocks the testosterone receptor. So it is anti-androgenic in nature, and that's why it is used in the prostate cancer. Okay, or ethyl estradiol can be used in the prostate cancer. Prostate cancer. Now, what is the adverse effect of this flutamide? Flutamide can cause different adverse effects like flushing, gynecomastia. Flushing, gynecomastia it can cause, and it can increase the virilism. Flutamide is an anti-androgenic in nature, right? Now, question number 143, drug used in the pulmonary hypertension. देखो पूछा है pulmonary hypertension में कौन सा drug use करेंगे? So answer for this question is nothing but the bosentan is a drug used in the pulmonary hypertension. तो ये bosentan क्या होता है? Bosentan is a drug which blocks the interleukin receptor. So interleukin, they are a neurohormone and they are increased in case of pulmonary hypertension. जहाँ पे pulmonary hypertension होता है वहाँ पे interleukin increase हो जाता है, interleukin का activity increase होता है. Bosentan is the interleukin receptor antagonist. It is interleukin receptor antagonist. So there are two interleukin receptor A and B. Particularly bosentan is a antagonist to interleukin receptor A. So it is used in the pulmonary hypertension. Next question is a breast cancer in the post-menopausal woman is treated by. Breast cancer post-menopausal woman में कौन से drug use करेंगे? So hormonal drugs they are mostly used in the breast cancer, cancer of endometrium or ovarian cancer. Answer for this breast cancer in a post-menopausal woman is treated by. Drug is nothing but the aromatase inhibitors. Aromatase inhibitor is not a drug, it is a category of drug. Aromatase inhibitor एक पूरा class होता है drug का. So what are the different examples of aromatase inhibitor? Letrozole, anastrozole and exmestane. Letrozole, anastrozole, exmestane, these are the aromatase inhibitor. What is the role of this aromatase? So aromatase will convert androstenedione into estrone. Androstenedione is converted into estrone. Androstenedione is converted to estrone by the help of this aromatase enzyme. So aromatase enzyme का काम क्या है कि androgens को estrone में बनाना. Aromatase inhibitor like anastrozole, exmestane, these drugs they are used in the cancer therapy. Okay, letrozole, anastrozole and exmestane, these are the aromatase inhibitor used in the breast cancer in the post-menopausal woman. Now we'll see the next question. Question number 145. देखो पूछा है first line drug for depression. Depression के लिए first line drug कौन सा है? So answer is nothing but the selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitors. So what is depression? So depression means a patient will lose its interest in the surrounding. He will get a suicidal thoughts. Okay, etc. etc. There are a lot of symptoms of depression that is beyond the scope of today's session. So selective serotonin receptor reuptake inhibitor. So they are the drug used in the treatment of depression. So what are the examples of selective serotonin reuptake inhibitors? Selective serotonin reuptake inhibitors. So example are nothing but the zetins. So fluoxetine, paroxetine, atomoxetine. So all the zetins, then citalopram. So these are the drug known as a selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitor. They are used in the treatment of depression. They are the first line drug, and their adverse effects are nothing but the CNS stimulation, then suicidal tendency. Suicidal tendency is the adverse effect of selective serotonin reuptake inhibitors. Now we'll see the next question. Question number 146. Imipenem always administered with. Imipenem जो है वो किसके साथ में दिया जाता है? So before that you should know what is imipenem. Imipenem is a kind of antibiotic, belongs to carbapenem class. इसका class होता है carbapenem. and carbapenem itself is a beta-lactam antibiotic. So it is a beta-lactam antibiotic which is known as a broad spectrum antibiotic. So in that you have imipenem, meropenem, etc. etc. Imipenem, meropenem और एक दो ड्रग होते हैं उसमें. So these are nothing but the carbapenem derivative. They are beta-lactam antibiotics. Now this imipenem has a short duration because this imipenem is metabolized in the kidney in the renal tubule by one enzyme known as a hydropeptidase. So imipenem is metabolized by hydropeptidase in the lumen, and that's why its half-life is less. So there is a one drug known as a cilastatin. Cilastatin is the drug which is combined with the imipenem. This cilastatin will inhibit that hydropeptidase enzyme in the kidney and will increase the T half of imipenem. Also ये cilastatin वो enzyme को inhibit करके cilastatin will inhibit the hydropeptidase enzyme which metabolizes the imipenem in the renal tubule. Okay. Again, this cilastatin will also prevent the generation of one toxic metabolite of imipenem. So imipenem का एक toxic metabolite होता है, ये cause करता है nephrotoxicity. There is one metabolite of imipenem which causes the nephrotoxicity, that is also prevented by cilastatin. Cilastatin inhibits the enzyme which degrades the imipenem and also prevent the generation of nephrotoxic metabolite. Right. Now next question we'll see. रेड मैन सिंड्रोम इज साइड इफेक्ट ऑफ, जैसे ही ये बहुत बार क्वेश्चन आ चुका है. रेड मैन सिंड्रोम इज एडवर्स इफेक्ट ऑफ वैंकोमाइसिन. व्हाट इज वैंकोमाइसिन? इज अ ग्लाइकोपेप्टाइड. वैंकोमाइसिन क्या है? इट इज अ ग्लाइकोपेप्टाइड एंटीबायोटिक. सो ग्लाइकोपेप्टाइड एंटीबायोटिक होता है. नाउ व्हाई इट कॉजेस रेड मैन सिंड्रोम? बिकॉज आफ्टर द इंजेक्शन और इंट्रावेनस इंजेक्शन ऑफ दिस वैंकोमाइसिन, जब भी ये वैंकोमाइसिन इंट्रावेनसली देते हैं, सो इट रिलीजेस द हिस्टामाइन. So it is a potent histamine releaser. So because of the histamine release, so there is a local erythema, redness in the body. So that causes the red man syndrome. Due to release of histamine by vancomycin, red man syndrome is there. Red man syndrome is adverse effect of vancomycin. Next we will see question number 148. Main side effect of aminoglycoside. तो aminoglycoside का side effect या adverse effect क्या होता है? So obviously aminoglycosides they will cause nephrotoxicity, ototoxicity and hepatotoxicity. They are teratogenic in nature also. Okay, so aminoglycosides, for example, streptomycin is there, gentamicin is there, neomycin is there, amikacin is there. So all these are the aminoglycosides. So they will have nephrotoxicity as adverse effect. They will damage your eighth cranial nerve. They can cause deafness. So ototoxicity, nephrotoxicity, hepatotoxicity, then teratogenicity. These are the adverse effect of aminoglycosides. So streptomycin, amikacin, gentamicin. So all these are the drugs. So out of that, gentamicin is mostly prone to the nephrotoxicity. Streptomycin is mostly prone to the ototoxicity. Streptomycin also causes hepatotoxicity. All these drugs they binds with the 50S and 30S ribosomal subunit of your bacterial ribosome and prevent the protein synthesis, interfere with the protein synthesis. Also causes misreading of mRNA code. Now question number 149. Trimethoprim inhibits bacterial dash dash. So trimethoprim क्या है? It is a dihydrofolate reductase inhibitor. Trimethoprim is the drug this drug you will find in the sulfonamides chapter. So sulfonamides they are the antibacterial drug which inhibit the synthesis of folic acid in the bacteria. So first of all you should know bacteria cannot utilize already formed folic acid. Bacteria जो ready-made folic acid है वो उसको यूटिलाइज नहीं कर सकता, तो इसलिए वो खुद का फॉलिक एसिड बनाता है बाय यूजिंग पाबा, पैरा अमीनो ब्यूटिक एसिड कन्वर्टेड इनटू फॉलिक एसिड एंड देन डायहाइड्रोफोलिक एसिड व्हिच इज वेरी इंपॉर्टेंट फॉर ट्रांसफर ऑफ वन कार्बन एटम चेन रिएक्शन. Sulfonamides inhibit the folic acid synthesis. Folate synthesis enzyme is inhibited by sulfonamides. And second step, conversion of folic acid into dihydrofolic acid is done by dihydrofolate reductase. Now this dihydrofolate reductase is inhibited by trimethoprim. So combination of sulfonamide plus trimethoprim, that is known as a synergistic combination. Sulfa drugs trimethoprim का combination जो है वो synergistic combination होता है. And remember sulfamethoxazole and trimethoprim they are combined together. Sulfamethoxazole plus trimethoprim they are combined together to form a cotrimazole. Cotrimazole जो है वो combination होता है sulfonamides का and trimethoprim का. तो sulfamethoxazole 400 mg and trimethoprim 80 mg. So that is known as a cotrimazole. It is a combination of sulfamethoxazole plus trimethoprim in a 5:1 combination. Now question number 150, फ्लोरोक्विनोन्स cause damage to. तो फ्लोरोक्विनोन्स का adverse effect क्या होता है? Fluoroquinones, they are nothing but the DNA gyrase inhibitor. They are antibacterial drugs known as urinary antiseptics. In that you have ofloxacin, norfloxacin, ciprofloxacin, nalidixic acid, moxifloxacin. So all the floxacin, ciprofloxacin, gatifloxacin, ofloxacin, norfloxacin, these are nothing but the fluoroquinones. They will damage your cartilage and tendons. So fluoroquinones, they are known as DNA gyrase inhibitor. ये क्या करते हैं? DNA gyrase नाम का जो एंजाइम होता है, that is responsible for the negative supercoiling of bacterial DNA after replication. So they inhibit the DNA gyrase enzyme and prevent the relieving of supercoiling that damages the DNA and cell will die. Now इनका एक adverse effect होता है. Fluoroquinones has one adverse effect. They will cause tendon and Achilles. So they damages the tendons and cartilage of your bone. So that's why fluoroquinone can cause damage to the cartilage and bones. Remember, okay? So first member of fluoroquinone family is known as a nalidixic acid. That is not a fluoroquinone, that is a quinolone. Now next question we will see. Question number 151, metallic taste in the mouth is caused by which antimicrobial drug? So lot of antimicrobial drug causes metallic taste in the mouth, but particularly antiprotozoal drug known as a metronidazole. So metronidazole causes metallic taste in the mouth. तो metronidazole जो है metallic taste in the mouth करता है. So it is an antiprotozoal drug used in the dysentery and diarrhea. It is a drug of choice in a variety of conditions: dysentery, amoebic dysentery, giardiasis, etc., etc. What is the mechanism of action? It damages to the DNA of the bacteria. Now what are the adverse effects? First is the metallic taste in the mouth. It causes nausea, vomiting, diarrhea, and epigastric pain. You have to remember. So metronidazole, it is an imidazole derivative that is known as metronidazole. Metronidazole, tinidazole, these are the antiprotozoal drugs. They are combined together with the fluoroquinones in treatment of diarrhea and dysentery. Now question number 152, optic neuropathy is a side effect of. Optic neuropathy किसका एडवर्स इफेक्ट है? ऑप्टिक न्यूरोपैथी एंड पेरिफेरल न्यूरोपैथी, ये दो टर्म्स आपको कॉमन आता है मोस्ट ऑफ द चैप्टर्स में. So mostly anti-cancer drugs and drugs used in the TB, they causes the neuropathy. So optic neuropathy is caused by one of the anti-tubercular drug known as a ethambutol. Ethambutol causes optic neuropathy. Ethambutol क्या करता है? Optic neuropathy करता है. And it has a 4 isomers. Ethambutol has a 4 different isomers. You have to remember. Question आ चुका है. One more drug is there, isoniazid, in from the tuberculosis. So that drug causes the peripheral neuropathy as well as optic neuropathy. So isoniazid peripheral neuropathy करता है, optic neuropathy करता है. To prevent that peripheral neuropathy caused by isoniazid, vitamin B6 is used. Okay, and this ethambutol causes the optic neuropathy. Remember, optic neuropathy. Question number 153, endocarditis with surgical or dental procedure prophylaxis. So drug used in the prophylaxis of endocarditis with surgical or dental procedure. Answer is the penicillins. Penicillins क्या है? These are nothing but the beta-lactam antibiotics obtained from fungus known as a Penicillium notatum. Nowadays it is obtained from Penicillium chrysogenum. So penicillin G is known as a benzyl penicillin, and there are a lot of semi-synthetic penicillin and synthetic penicillins. So they inhibit the synthesis of cell wall of bacteria. Question number 154, empiric therapy for community acquired pneumonia for outdoor patient setting. So answer for this is nothing but the macrolides. So macrolides, they are nothing but the kind of antibiotics. They will have large lactone ring in their structure. Macro मतलब बड़ा, lides मतलब lactone ring. तो बड़ा, बहुत बड़ा lactone ring किसमें है? macrolides में. So ये जो कैटेगरी होता है एंटीबायोटिक की, इसमें ड्रग कौन सा आते हैं? So macrolide will have like your azithromycin, roxithromycin, roxithromycin, clarithromycin, erythromycin. So erythromycin, roxithromycin, clarithromycin, these are the drug which belongs to macrolide category. तो इसमें erythromycin पहला आएगा, then azithromycin आएगा, roxithromycin आएगा, erythromycin, clarithromycin, roxithromycin, all they are known as macrolides. इसमें और एक ड्रग आता है टेलिथ्रोमाइसिन. So टेलिथ्रोमाइसिन is known as a ketonide. टेलिथ्रोमाइसिन कीटोलाइड होता है, बाकी के जो है वो मैक्रोलाइड होते हैं. So they will bind with the 30th ribosomal subunit and will prevent the protein synthesis of bacteria. They are known as the macrolides. They are used in the respiratory tract infection and different infection, joint and bone infection, soft tissue infection, UTI, etc. etc. Question number 155. Drug of choice for cryptococcal meningitis in the AIDS patient. So answer is nothing but the fluconazole is the drug of choice in the cryptococcal meningitis in the AIDS patient. Now it is a drug of choice in a variety of condition. It is a azole antifungal drug. क्या है ये azole antifungal drug? Fluconazole is a azole antifungal drug. Drug which inhibit the cell wall synthesis by inhibiting the synthesis of beta V glucan. Beta V glucan again is a very important component of fungal cell wall. So obviously drug कौन से होंगे? Antifungal. So drug which inhibit the cell wall synthesis by inhibiting the synthesis of beta V glucan. So which is a very important component for fungal cell wall. Okay. So drugs are nothing but the echinocandins. तो इसमें echinocandins कैटेगरी होता है antifungal drug का. In that you have example like capsopungin, micapungin and anidulafungin. So capsopungin, micapungin, anidulafungin, they inhibit the cell wall synthesis. Okay, by cell wall synthesis by inhibiting the beta V glucan. Now question number 157. Terbinafine is used to treat. So terbinafine क्या होता है? It is again antifungal agent. It is a squalene epoxidase inhibitor used in the treatment of onychomycosis. ये fluconazole होता है. So they inhibit the 14 alpha demethylase enzyme, which is required for conversion of lanosterol to ergosterol. ये fluconazole जो है ये they will prevent the synthesis of ergosterol in the fungus. Now this terbinafine is a squalene epoxidase inhibitor. Squalene epoxidase inhibitor होता है terbinafine, and fluconazole is nothing but the 14 alpha methylase inhibitor. Will prevent the formation of ergosterol from lanosterol. Now question number 158. Leishmaniasis is treated by. So what is the cause of leishmaniasis? Leishmaniasis means काला आजार. It is known as a काला आजार. So remember leishmaniasis में drug of choice होता है amphotericin B. Leishmaniasis में drug of choice amphotericin B होता है, and another drug होता है sodium chilbogluconate. ये भी drug. So leishmaniasis is treated by sodium chilbogluconate, and drug of choice is nothing but the amphotericin B, liposomal amphotericin B. Now sodium chilbogluconate is nothing but the antimony compound. ये क्या होता है? Antimony compound होता है. Now question number 159. Cytomegalovirus rhinitis in immunocompromised patient when ganciclovir fails. तो immunocompromised patient में cytomegalovirus का infection होता है और ganciclovir fail होता है, तो कौन सा drug यूज करना है? Foscarnet. Foscarnet is the drug used when ganciclovir fails in the cytomegalovirus rhinitis. But remember ganciclovir is the drug of choice in the cytomegalovirus infection, right? Now question number 160. Orange urine or body fluid. Orange coloration of urine or orange coloration of body fluid is side effect of one antidiuretic drug known as rifampin. So it causes the orange coloration of urine and body fluids. ये क्या होता है? इसका मेटाबॉलिज्म होता है लीवर में, एंड वो एक मेटाबोलाइट बनता है. वो मेटाबोलाइट क्या करता है? ऑरेंज कलरेशन ऑफ यूरिन एंड बॉडी फ्लूइड्स. अगेन देयर इज वन एडवर्स इफेक्ट ऑफ दिस रिपम्पिसिन, hepatotoxicity. Now what is the mechanism of action of this rifampicin? So it inhibit the rifampicin inhibit the DNA dependent RNA polymerase. DNA dependent RNA polymerase को inhibit करता है. It causes the orange coloration of urine and body fluids. It is a first line drug used in the treatment of tuberculosis. You can order this magic bullet for GPAT Niper DI Pharmacist. Read twice before the exam and qualify 100%. You can see we have very much promising results. Thousands of students they are qualified and they are placed in the Nipers. You can also join our GPAT Niper 2024-25 online course. Here you will have live lectures on Wednesday, Saturday, Sunday. Subject wise and chapter wise lectures will be there. Study material is available in the form of hard copy. So these books will be given. Online test series will also be there. Everything is there in 8,000, and the validity of this course is nothing but the 2 years. And if you get all in rank below 20 in the GPAT exam, your fees will be returned in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100%.